Hi, I'm Kevin with My Victory, the online exercise platform for cancer survivors featuring more than 2,000 ability-appropriate exercise classes. Welcome to our series on exercise for specific surgeries with exercise recommendations by Dr. Catherine Schmitz in her book, Moving Through Cancer. This video focuses on exercises you should do if you've undergone abdominal surgery. It's important to understand that your primary job after an abdominal surgery is to heal. Keep moving, but to heal. Follow the general guidance for getting and keeping moving at the start of this section, but watch for signs and symptoms of an incisional hernia, which may include nausea, vomiting, fever, burning or aching near the incision, abdominal pain and discomfort, faster than usual heartbeat, constipation, diarrhea, or thin, narrow stool. If you have any concerns about the possibility that you may have developed an incisional hernia, talk to your doctor. To avoid the risk of any incisional hernia, follow your doctor's advice as to when you can return to resistance exercise. Most people can return to all activities within 6 to 8 weeks. As noted at the beginning of this section, during this period, your focus should be on building time in aerobic activity as opposed to building intensity. Increase your aerobic activity, focusing mostly on walking, gradually to the point that you're doing between 150 to 300 minutes a week of moderate level intensity for activity. Abdominal surgeries weaken the core muscles, so it's important that you begin the process of re-strengthening them as soon as it's safe to do so. So we're going to start off on the floor and do a couple of examples. You can do these completely in bed, and you don't even have to move your positions as we get through this. So let's go ahead and lay down on our back, and we're going to start off with some head lifts. So it's going to be a modified version of a sit-up. What we're going to do is try to give ourselves a nice big double chin and just lift your head up slightly until you feel the front side of that core engage. We're not trying to get up very high off of the bed or the ground. We're just trying to get the front side of those abs to engage, keep everything nice and tight, and not overstrain anything. If you have the ability to, bringing your feet up into a nice bridged position here is going to offer some support to that lower back and make sure that we're actually using those abs and not compensating in that lower spine. While we're here, our next exercise is going to be a glute bridge or a butt lift. What we're going to do is set those feet into that bridge position, get those heels as close to your butt as comfortable, and we're going to just lift the hips up a little bit. Ideally, we're going to try to get a nice straight line from our knees to our shoulder, but that range of motion is going to come over time. And we're trying to just use those hips and focus on lifting. What we want to make sure of is that we're not lifting so high that we're arching that back and then that stomach starts to bow out. We want to stay nice and engaged through that core. Think trying to keep your ribs down, but again, stay with whatever that range of motion is where you start to feel the front side engage and using those glutes to drive that motion. And again, same concept as those head lifts, trying to think nice big double chin, keep that neck nice and flat. It's going to offer a little bit of extra engagement without overstraining anything on that front side. We're going to lower those hips all the way down, keep things nice and flat. We're going to open those arms up into a T, whatever's most comfortable, whether palms down towards the ground or palms up. And we're going to very slowly let those legs drift to the side and then pull them back up and drift to the other side. Now to start off with, if you go a little bit wider with your feet, it's going to be a little bit more hip dominant. You're going to not feel as much stress or strain through the abdominal area. And as we want to add a little bit of extra tension, we can get those feet a little bit closer together. You'll feel that lengthening or that slight pulling and stretching of those abdominal muscles as we shift from side to side. A big key component with this exercise is to maintain control, not let those legs drop all the way to the side, and make sure that we're feeling those ab muscles engage all the way through here, keeping things nice and tight, keep those shoulders flat on the ground, and again, control that movement from side to side. Try to keep those knees touching as we go. You can even let the trail foot come up off the ground as we go to the side. It'll offer a little extra challenge for those abs. So we're going to repeat all of those exercises for roughly 10 reps. On those side-to-side ones, we're going to do about 10 reps per side. But take your time in between. Take as much rest as you need to. Let everything recover between exercises. They're all in the same position, so take your time moving through them. And rest after the set. Maybe get in a second set if you're feeling up to it, or even a third if you want to challenge yourself just a little bit more. But if there's any other exercises that your medical staff has recommended or prescribed to you, please do them regularly. Studies show that people who do these types of exercises regularly recover better and faster. Consider asking for a referral to physical therapy if it's not automatically offered. This way you can enjoy the full benefit and expertise of these important professionals. Thanks so much for joining me today. Combined with a healthy diet, exercise can be very therapeutic. And we wish you success. Have a great rest of the day.